Welcome to the deep dive. Today, we are looking at a pretty bizarre medical paradox because, what happens when you take highly concentrated light, like a medical laser, and you introduce it to the most sensitive, complex tissues in the human body?
Yeah, it's a huge question
Yeah.
because we usually think of light as just, well, illumination, right? But in this context, it becomes a surgical tool, a tool capable of provoking really intense biological changes.
Exactly.
And those changes can be radically unpredictable when the tissue in question is already harboring a microscopic dormant resident. We're really talking about the interplay between high-energy devices and viral latency.
Right, and we are focusing on a massive trend right now for this deep dive, which is vaginal tightening and rejuvenation procedures.
Oh, yeah, they're booming.
They really are. I mean, these energy-based treatments are marketed heavily for literally everything from, alleviating menopause symptoms to increasing sexual pleasure. But we are exploring a highly critical intersection today for you, the listener.
Now,
We want to know what happens when you introduce these medical lasers to a body that has a history of genital herpes, or HSV. I mean, does a history of genital herpes make vaginal tightening safety fundamentally compromised?
it's basically a collision of two completely different biological realities. And navigating it requires understanding um, cellular signaling, thermodynamics, and virology. It goes far beyond just ticking a box on a checklist at a clinic.
Yeah, it's not simple at all. And to get to the bottom of this, we've gathered a massive stack of medical literature. We are pulling from official guidelines from BAHH, which is the British Association for Sexual Health and HIV.
Really improved source, yeah.
We also have safety protocols from the Aesthetic Complications Expert, or ACE, group, and we're analyzing a major overview from the UK's National Institute for Health and Care Excellence, an FDA safety communication, clinical trial data, and, the actual day-to-day protocols used by dermatology and gynecology clinics.
And when you look at this stack, you see a medical community attempting to walk a very delicate biological tightrope. I mean, they are trying to balance significant symptom relief against the risk of waking a dormant virus.
Right. So our mission for this deep dive is clear. We want to uncover if a history of genital herpes makes vaginal laser treatments unsafe for you, what the true risks actually are, and how practitioners are mitigating those risks. Okay, let's unpack this.
Do it.
Before we can even answer if these procedures are safe, we have to look at the biology. We need to understand the mechanics of what happens when a laser meets dormant HSV.
Yeah, let's break down the laser's objective first.
Okay.
So energy-based vaginal rejuvenation typically relies on carbon dioxide, so CO2, and erbium lasers.
Okay.
And the primary mechanism isn't just like a gentle warming of the tissue.
Right, it's not a heating pad.
Exactly. The therapeutic goal is to induce controlled thermal damage to the vaginal epithelium.
Which sounds intense. It's intentional trauma. From reading through the clinical data, the laser energy specifically targets the water molecules within the connective tissue, right?
Yes, that's exactly it. The laser rapidly heats and vaporizes that water, and that creates these microscopic columns of thermal injury deep in the mucosal wall.
Okay, so you're literally vaporizing tiny columns of tissue.
You are. And that localized injury acts as a massive biological distress signal. When your body detects those thermal columns, it initiates a major wound healing cascade.
Because it thinks it's under attack.
Exactly. So fibroblasts, which are the cells responsible for your tissue's structural framework, they migrate to the damaged area. And they start producing dense new collagen in a process called neocollagenesis.
Right, new collagen.
Yeah, and simultaneously, the heat triggers angiogenesis.
Yeah.
That's the formation of new microvessels to increase blood supply.
So the end result is supposed to be a thicker, more elastic, and better lubricated mucosal lining. Because the body essentially remodels the tissue since it thinks it's recovering from a severe burn.
That's the exact mechanism.
But, and this is the big but, we have to factor in the other half of the equation, right? The mechanics of the herpes simplex virus. Because following an initial infection, the virus never is completely eradicated from the host.
No, it's a lifelong resident. It retreats from the skin's surface, and it actually travels up the nerve pathways. It establishes latency, so it hides out, in the dorsal root nerve ganglion.
The dorsal root nerve ganglion, that's near the spine, right?
Yeah, it's a cluster of nerve cell bodies situated right near the spinal cord. The virus inserts its genetic material into the nucleus of those nerve cells and basically goes into a state of deep latency.
So it's sleeping.
Basically, yeah.
And this is where the biological collision happens. The laser relies on thermal trauma, tissue manipulation, and intense heat to trigger that collagen production we talked about. But those physical insults generate inflammatory cytokines.
Right, those chemical distress signals.
Yeah. And those signals travel directly up the sensory nerves from the vaginal tissue right into that exact dorsal root ganglion where the virus is hiding.
It is a perfect storm. I mean,
Mhm.
the inflammatory signals caused by the laser disrupt the viral latency. The virus basically senses that the host is under cellular stress, so it reactivates and it begins rapid viral replication.
Because it's an opportunist.
Exactly. And then the newly formed viral particles travel back down the exact same nerve pathways to the mucosal surface, erupting into a really painful herpetic lesion.
Wow. It's like having a biological sleeper cell embedded deep in your nervous system.
That's a great way to put it.
And that sleeper cell is programmed to activate only when it intercepts a massive distress signal sent over the body's communication wires.
Uh-huh.
So by firing a high-power laser into that tissue, you are intentionally broadcasting the exact SOS signal the virus is waiting for. It's like waking a sleeping bear.
Yeah, you're poking the bear with a very hot stick.
Right. So if we know the laser reliably triggers the sleeper cell, if we know it wakes the bear, wouldn't the medical community just issue a blanket ban? Like, why is this procedure even offered to anyone with a history of HSV?
What's fascinating here is that the medical community doesn't view viral latency as an absolute barrier. They view it as an engineering problem to be managed.
Really? An engineering problem.
Yeah, instead of an outright ban, they implement chemical roadblocks, basically trying to intercept the virus before it can capitalize on that thermal stress.
Okay, so if the laser acts as an undeniable wake-up call for the virus, how are doctors ethically justifying this procedure at all? Like, who is actually getting the green light and who is getting turned away at the clinic door?
Well, there's a strict, non-negotiable contraindication across all the clinical sources. We saw this notably highlighted in the protocols from Dr. Natalia Novikova's clinic and also Aesthetic Allure.
Okay, what is it?
If a patient presents with an active outbreak, meaning any visible blisters, ulcers, or even just the early tingling prodromal symptoms, the procedure is entirely off the table.
A hard no.
Absolute hard no. The tissue must be completely healed. Applying thermal columns to actively shedding viral tissue would drastically exacerbate the infection and severely impair the healing of the laser wound itself.
Well, that part is straightforward, at least. But the aesthetic allure source brings up a much more insidious issue, which they refer to as the cloak of invisibility.
Yes, the invisible carriers.
Right. A massive portion of the population carries HSV asymptomatically. The virus is just sitting in their nerve ganglia. They might even intermittently shed it, but they have never, ever experienced a visible clinical outbreak.
It's so common. And these invisible carriers represent a really significant clinical blind spot. I mean, a patient might genuinely believe they are HSV negative, they consent to the laser procedure, and then they experience a massive primary-like outbreak triggered entirely by the thermal trauma.
Which sounds terrifying. And for you, the listener, this raises an obvious question. If asymptomatic carriage is so common and a laser is a known activation trigger, shouldn't a mandatory serological herpes test be a strict legal requirement before a doctor points a CO2 laser at your mucosal tissue?
It seems perfectly logical, but serological testing for HSV is notoriously tricky to interpret regarding clinical relevance. And it's just not a universally mandated standard in aesthetic gynecology right now.
So what do they do?
Instead, clinics rely heavily on a detailed patient history. For anyone who does disclose a known history of the virus, even if their last outbreak was literally a decade ago, practitioners deploy a strict prophylaxis protocol.
Right, and according to the Aesthetic Complications Expert Group guidelines, prophylactic antiviral medication is absolutely mandatory in those cases. The protocol uses drugs like acyclovir, valacyclovir, or famciclovir.
Standard antivirals, yeah.
But diving into the pharmacology of how these drugs actually work is wild. I mean, they aren't just poisons that kill the virus directly in your body. They are prodrugs, specifically guanine nucleoside analogs.
Right, which means they circulate through your bloodstream in a completely inactive state. They don't affect healthy, uninfected human cells at all.
Which is so cool. From what I gathered in the pharmacology research, it's essentially a chemical decoy. The drug mimics one of the fundamental building blocks of DNA. But the drug remains totally inert until it encounters a specific enzyme called viral thymidine kinase.
Yeah, viral thymidine kinase. And the key is that enzyme is only produced by the herpes virus itself, and only when it is actively replicating inside a cell.
So the drug just waits for the virus to make a move?
Exactly. The virus's own enzyme processes the drug, basically converting it into its active form. When the herpes virus tries to copy its genetic material to multiply, it mistakenly grabs this decoy building block and inserts it right into its growing DNA chain.
But the decoy is flawed, right? It lacks the chemical hook needed to attach the next piece of DNA, so the chain just terminates. The virus physically cannot replicate anymore.
It's such an elegant defense. I mean, the virus inadvertently activates the exact weapon that stops its own reproduction. And to ensure that chain termination mechanism is fully active before the thermal columns hit the tissue, the ACE group protocol dictates starting the antiviral, which is typically a 500 milligram dose of valacyclovir 1 to 2 days prior to the laser session.
Got it. So preloading the decoy.
Yes. And then the patient maintains that dosage for 5 to 7 days post-procedure while the tissue undergoes its most intense inflammatory healing phase.
So what does this all mean? It means radical transparency with your medical provider is literally the only thing standing between you and a severe complication.
100%.
If you feel embarrassed about a history of HSV, or maybe you just assume it doesn't matter because you haven't had an outbreak in years, you are bypassing the one chemical decoy system that protects you. But, managing the viral threat introduces a completely different problem.
Oh, yeah. The device itself.
Right, the physical damage of the laser. Because suppressing the virus with valacyclovir only solves the biological complication of HSV. It does not mitigate the mechanical risks associated with intentionally burning the vaginal epithelium.
No, it doesn't. To evaluate the true safety of the procedure, we have to look at the broader device-level risks.
And the clinical trials do report substantial short-term benefits. We have to acknowledge that. These energy-based devices are successfully treating genitourinary syndrome of menopause.
Yeah, GSM is a big one.
By thickening the mucosal lining, they are reducing dyspareunia, which is chronic pain during intercourse, and providing relief for stress urinary incontinence by tightening the anterior vaginal wall.
But, and this is crucial, we have to heavily weight those short-term symptom improvements against the 2018 FDA safety communication. Because the FDA took a very aggressive stance.
They really did.
They warned that the marketing of these lasers for, quote, vaginal rejuvenation had far outpaced the robust scientific evidence regarding their long-term safety. They explicitly cited reports of severe adverse events.
Like deep vaginal burns.
Deep burns, significant scarring, and chronic debilitating pain.
And when you read the UK's NICE overview, the National Institute for Health and Care Excellence, those FDA warnings translate into some harrowing real-world case studies. I mean, we aren't just talking about mild discomfort here.
No, not at all. The NICE report detailed a really sad case of a 68-year-old woman. She underwent 3 separate courses of laser therapy to address menopausal atrophy. And instead of restoring elasticity, the thermal trauma caused her fibroblasts to overproduce completely disorganized rigid collagen.
So it basically backfired.
Completely. She developed severe vaginal dryness and persistent burning.
And upon physical examination, her doctors found a crescent-shaped fibrous band directly in the mid-vagina. Like, the laser essentially induced so much internal scar tissue that it created a physical stricture.
It partially obstructed the vaginal canal.
Right. She had to undergo intense rehabilitation with topical estrogen and physical dilators for a long time just to try and break down that iatrogenic scarring.
And there was another case in that same NICE overview involving a patient who suffered deep vaginal lacerations upon resuming intercourse just weeks after the procedure.
Lacerations?
Yeah. The thermal ablation had compromised the structural integrity of the tissue so severely that it simply tore under standard friction.
Man, it's like hiring a contractor to renovate a historic house because you have a drafty window. The draft represents the incontinence or the dryness, but the contractor brings in heavy, high-powered demolition tools.
Right, way too aggressive.
They might technically fix the draft by sealing everything up, but their aggressive methods structurally damage the home's foundation. You trade a drafty window for a house that is structurally compromised and prone to collapsing.
If we connect this to the bigger picture, the fundamental issue is a severe lack of longitudinal data. The longest follow-up periods we currently have in these aesthetic laser trials only track patients for 1 to 2 years.
Which is literally nothing when you consider a patient has to live in that body for decades.
Exactly. We have absolutely no idea what happens to the vaginal tissue architecture 5, 10, or 20 years after intentionally subjecting it to microscopic thermal burns. The tissue might become permanently fibrotic. We simply don't have the data to guarantee long-term mechanical safety.
Okay, so we've established that high-intensity thermal lasers damage tissue, cause scarring, and act as a massive trigger for dormant HSV. But while we were digging through the research literature, we found a secondary application of light therapy that completely upends everything we just discussed.
Oh, this is the wildest part. We really need to look at a narrative literature review from the PMC database regarding LLLT, or low-level laser therapy.
Right.
Because while ablative CO2 lasers destroy tissue and trigger outbreaks, low-level non-thermal laser light is actually being utilized as a highly effective treatment to suppress severe recurrent genital herpes.
A medical laser acting as an antiviral therapy. I mean, it's hard to wrap your head around. And they aren't just pointing this low-level light at the skin, right?
No. The literature details a protocol called intravenous laser blood irradiation, or ILBI.
Wait, intravenous? Like in a vein?
Yes. They are physically channeling specific wavelengths of laser light directly into the patient's bloodstream via an intravenous catheter.
It sounds like pure science fiction, but the biological mechanism is grounded in photobiomodulation. Unlike the CO2 laser, which uses high power to vaporize water, LLLT uses very specific low-intensity wavelengths, usually in the 525 or 633 nanometer range.
And the key is, this light doesn't generate heat.
Right, no thermal damage. If we look at the cellular level, those specific wavelengths of light are being absorbed directly by the mitochondria inside our white blood cells. It's essentially acting like photosynthesis for the human immune system.
That's exactly what it is. The light photons are absorbed by an enzyme called cytochrome C oxidase inside the mitochondria, which rapidly boosts the cell's ATP production. Basically, it's energy.
So by increasing that cellular energy, the laser light normalizes the patient's peripheral immunity. Because the clinical data showed that after a course of ILBI, patients exhibited a massive increase in CD8 positive cells.
Right, those are the cytotoxic T cells. They are the specialized hunters of the immune system that seek out and destroy virus-infected cells. And the light therapy also normalized the activity of natural killer cells in the bloodstream.
It just provides the immune system with the metabolic energy it needs to keep that sleeper cell locked down. The clinical results from the PMC review were just staggering.
They really were.
The intravenous laser blood irradiation cut the recurrence rate of genital herpes by half. And in 19% of women suffering from severe, highly recurrent, and previously untreatable genital herpes, the light therapy induced stable long-term remission.
Let that sink in. It fundamentally altered the host-virus dynamic without a single milligram of antiviral medication.
Here's where it gets really interesting. I want to synthesize this wild paradox for you, the listener. If a doctor utilizes a high-intensity ablative wavelength of light on your tissue to tighten it, the resulting thermal trauma acts as a distress signal that wakes the herpes virus, causing a massive outbreak.
Yeah.
But if a doctor utilizes a low-intensity wavelength of light and channels it into your bloodstream, it acts as a mitochondrial energy donor, supercharging your immune system to force the virus into a deep, permanent remission. I mean, wait, so high-intensity light wakes it and low-intensity light heals it?
This raises an important question about how we even define medical technology. Because a laser is not inherently a weapon or a cure. The biological outcome, whether it triggers a lifelong virus or suppresses it, is entirely dependent on the calibration of the tool.
It's all in the settings.
Exactly. The wavelength, the wattage, and the delivery method dictate whether the light destroys tissue or heals it at the cellular level.
It completely reframes our understanding of light as medicine. So to bring this all together for you today, does a history of genital herpes make vaginal tightening inherently unsafe? Well, not strictly, provided you have no active lesions and you absolutely adhere to the prophylactic antiviral protocol.
Right, taking the valaciclovir days before and after to ensure the chemical decoy is fully in place. You can manage the viral risk.
But mitigating the HSV risk does not negate the primary risks of the device itself. You still have to weigh those short-term benefits against the FDA's warnings of severe internal scarring, strictures, and chronic pain, knowing that we lack long-term safety data.
Yeah, that's the real trade-off. And the ultimate takeaway for you as a patient navigating this aesthetic space is that your safety relies entirely on total transparency.
Completely. Elective procedures operate on incredibly precise biological margins. Withholding a medical detail like a history of a dormant virus, even out of embarrassment, fundamentally changes the mathematical equation of your treatment.
It removes your only chemical safety net. A practitioner can only protect you from the variables they actually know about. Informed consent requires an informed history.
Very well said. As we wrap up today's deep dive, I want to leave you with a final thought to ponder. Today, we learned that a highly calibrated wavelength of light can essentially hack human mitochondria to suppress a lifelong viral infection, while a slightly different wavelength violently awakens it.
Yeah.
It makes you wonder, as our technology evolves and as we finally begin to map the exact frequencies of cellular communication, how close are we to discovering the specific light wavelengths that might control, awaken, or even permanently cure the myriad of other dormant diseases hiding deep inside our nervous system?